Hello, my name is George Angano and we are about to assess Chris Gonzalez for this GenMed video. The GenMed examination actually begins from the beginning as soon as you walk into the room. You can tell the level, the posture in a person, the bump, any obvious deformities, muscle density, level of consciousness, any skin lesions, infections, a state of nutrition, and or hygiene. Once some rapport is established and the level of comfort has been established also through the history taking process, now we can take our patient's heart rate and respiratory rate simultaneously, so that way the patient doesn't alter their breathing rate inadvertently. So what you want to do is place their hand either on a table or on their leg in this instance, so that way you can take the heart rate, but you also want to place your hand up against their arm. This gives us two options. Option one is to get the tactile sensation as they're inspirating, and you can also see their chest expand as they're inhaling while you're looking at your watch. Okay, you also want to not only count the inhalations, but you also want to see the character of their inhalations. If they're forcefully, if they're weak. Okay, and now we will proceed to take their respiratory rate. You usually take it for about a minute, or you can take it for 30 seconds multiplied by ×2, which will give you a total rate per minute. For the amount of 30 seconds, she did 6 inspirations, which multiplied by 2 to calculate the minute is 14. Oh, she is fine then. What is it?
Oh.
I said, fuck. I was doing good too. I said 6. Crop it up. So for 30 seconds, I got a number of 7, which leaves us at 14. Now, for 30 seconds, I received a number of 7, which leaves us at 14 beats, 14 respirations per minute, which is fairly well, seeing how it is usually 12 to 20 breaths per minute in an adult. And now you want to take their pulse rate, again preferably not changing your position, so that way they won't be able to tell what you were taking, and inadvertently change the respiratory rate. For 30 seconds, I have calculated that she was at a 36 beats per minute, which leaves us at a total of 72 for that minute. Now, that's normal, seeing how anything between 60 to 100 beats per minute is within normal limits for an adult. Anything above 100 is tachycardia, and anything below is bradycardia, which can usually be found in endurance athletes. Now we will attempt to take our patient's blood pressure using a stethoscope and our blood pressure cuff. Okay, you want to make sure you have the right size for the patient, that it covers about 80% of their upper arm, and that it is not too small, because a small blood pressure cuff will give you relatively high results. Okay, you want to first find the brachial artery, which is medial to the biceps tendon. Once you have established that, you want to place the artery marker over the artery, close the cuff, and then to avoid an osculatory gap, you want to, instead of taking your blood pressure right away, you want to place your fingers on her radial pulse, pump the cuff up until about 100, and then keep going until you have fully lost her pulse. All right. It seems I have lost her pulse at 108. Now I want to release the pressure quickly and add 20 to that. And now I will begin to actually take my blood pressure. You want to make sure you place these correctly. The ear tips forward, and place the drum within the 2 centimeter gap of the blood pressure cuff and the antecubital fossa. All right. Her results are 112/72, which are fairly normal. The average blood pressure is 120/80. High blood pressure or high hypertension begins at 140/90. Stage 1 is 140 through 159/90 through 99. And then stage 2 begins from anything equal to or higher than 160/100, and then hypertensive crisis begins at anything over or equal to 180/110. We'll be taking the patient's temperature using this oral thermometer. You'll want the patient to open her mouth and raise her tongue as you place the thermometer. Now close it. You usually want to leave it for about a minute or until it beeps. And this is the gold standard. It's usually the axillary temperature is usually 1 degree less, and a rectal the temperature, which is not taken usually or as often as it should be, is 1 degree higher. Her Celsius temperature was 35.3 degrees Celsius, which is slightly lower than average. Average is 37 degrees Celsius, which is in Fahrenheit is a 98.6. Now, you can be hyperthermic if your temperature is anything higher than 99.5 degrees Fahrenheit or 37.5 degrees Celsius, or you could be hypothermic if your temperature is anything less than 95.9 degrees Fahrenheit or 35.5 degrees Celsius. She is fine. Now we'll be examining Chris's head and neck for any enlargement in the lymph nodes. The examination actually starts when you walk up to the patient, and you can see for any asymmetry or lack of symmetry in the areas which would signal enlargement. Now you want to advise the patient that you are going to be standing behind them and you are going to be palpating them, so that way they don't think that you're actually going to choke. Now we will be beginning the palpations of the lymph nodes. I will start with the anterior cervical lymph nodes, which are here. And these drain the pharynx, the tonsils, and the thyroid gland. Then I will go back to the posterior cervical lymph nodes. and these drain the skin, the back of the head, and the enlargement of the upper respiratory systems. I will then go to the preauricular lymph nodes, followed by the post-tonsillar lymph nodes, and then the submandibular, which are underneath or inferior to the mandible, the postmental, there's submental under the chin, and then the supraclavicular lymph nodes here. All right, and when you are palpating, you are looking for any firmness, tenderness, stiffness, warmth, or enlargement within the lymph nodes, which would notify you that there is something wrong. The normal feeling for a lymph node is non-tender, small, within less than 1 centimeter diameter, and rubbery. Now that we are here, we can automatically move into the throat and mouth examination. Standing from behind, you can palpate the thyroid cartilage with 3 fingers, working your way laterally to medial. And then you can start by feeling thyroid cartilage, assess that, which is the Adam's apple. Then you can assess the notch atop of the thyroid cartilage and work your way inferiorly to that, to the lobes of the thyroid cartilage. You are looking for any enlargement or tenderness, which can be unilateral or bilateral, or any symmetry or asymmetry from one side to the other. You can work our way now to the mouth exam. You want to put some gloves on to protect yourself because you will be having him open his oral cavity and could be potentiously infectious. Once you have protected yourself, you want to instruct the patient to open his mouth as you light the otoscope light into his mouth, pressing the tongue down, getting a view of the uvula, the hard palate, the soft palate, and the posterior pharyngeal wall. All right, now that all that is set, you want to remove the cheek from the gingiva and see if there is any redness, white spots, any tumors or ulcers. You want to work your way posteriorly to anteriorly, seeing all front and then on both sides. Again, working yourself posteriorly to anteriorly, and then as well as on the top. All right. Good, Chris. All right. Now you also want to instruct them to raise their tongue to the roof of their mouth and get a look under. Again, looking for any redness, white spots, any ulcers or tumors. All right. Good job. Now we will be examining Chris's ear. So I first want to grab an otoscope and check the anterior and posterior aspects of the ear to make sure that there isn't any lesions, hematomas, or cancerous deformities. Once I have established that, I also want to make sure that I hold the otoscope in the hand of which the ear that I am checking. So since I am checking his left ear, I am holding the otoscope in my left ear, which allows me to pull the helix back to straighten out the S-shaped ear canal, so that way the speculum can enter without causing any irritations. I want to apply or direct the speculum in direct vision to not cause, again, any irritation to the ear, and then proceed to go in. Now, if there is swelling or redness of the ear canal that doesn't allow the speculum to go in, this symptom is called an otitis externa. But since Chris doesn't have that, I am able to go in and look at his tympanic membrane. Once you work past the cerumen, you will see that you have come in contact or vision of the tympanic membrane. The tympanic membrane should normally be silver, gray, or translucent, with no bubbling, no scars, and no proliferations.
You will also notice that the tympanic membrane there is a protrusion of the malleus, and underneath there is also a light reflex. If the tympanic membrane happens to be red and lacks a light reflex, infection is called an otitis. If the membrane is red and lacks a light reflex, this infection is called an otitis media. But apparently, Chris's ears appear to be fine.
Just have to carve that.
Was that like screaming in your ear?
Now we will be conducting an ear examination, which includes 2 tests. The first being the Weber's test. For this test, you want to place the tuning fork either at the top of the head, in the middle of the forehead, or at the bony prominence of the nose. You have to make sure that wherever you place it, it is at equal distance to the ears. And you also want to advise your patient to let you know if he or she can hear the vibration more prominently on one side or the other. Now we will be performing the test. Can you hear that equally?
Yeah.
Cool. He heard that equally, which is good. If you were to hear that, say more on his right ear, that would mean that he would have either a conductive hearing loss on his right ear or a sensory neuro defect on his left ear. Now we will be performing the Rings test. For the Rings test, you want to place the tuning fork on the bony prominence behind the ear first, and then you want to remove it, hit the tuning fork again, and then place the tuning fork parallel to the ear. All right. Can you hear that?
Yeah. Yeah.
Which one did you hear louder?
Second one.
Second one? Okay, cool. You want to perform the test bilaterally to see if there is any hearing loss. You hear that?
Yeah.
You hear that? Which one did you hear more?
Second one.
Second one. All right. So Chris obviously has great hearing. If you were to hear more on the posterior one and less on the anterior one, he would be performing or showing a loss, conductive hearing loss. And that was the Rings test. Be performing a nose exam on Claudia here. What I would first want her to do, well, first we can see if the nose is symmetrical to both sides, and then we can have her close one of her nostrils with one of her fingers, inhale and exhale to see if the pressure or the inhalations or exhalations are equal on both sides. Perform bilaterally, thank you. And then now we can proceed to check the nostrils. Now the nares. Tip the head. With one hand you can point the tip of the nose. You're gonna look inside what color the mucosa is. If you have red, yellow, or greenish mucosa, that indicates that it is an infection, bacterial infection. If you have clear mucosa, that is a sign of an allergic reaction. And if you have straw-colored mucosa, that is a sign of head trauma. Now you also want to palpate the sinuses that are related to the nose, which is the frontal sinus and the maxillary sinus. If the patient has any tenderness, that is a sign of underlying inflammation. Was that painful at all? Okay, she is good. You could also test this by using the otoscope you would first dim the lights, using the otoscope to shine the light through the maxillary sinus. As the patient opens the mouth, you should see a light through the hard palate of the mouth. If you don't see the light, that means that there is inflammations and the sinuses are fluid filled. You could also test for any sinus inflammation of the maxillary sinus by using a tongue depressor, tapping on the teeth that are underneath that maxillary sinus, and that would cause discomfort.